I'm Thomas Coleman, and this is my evidence-based protocol for a grade 3 soleus strain. So the etiology behind this, a lot of predisposing factors that could lead to a muscle strain, soleus, calf weakness, ankle joint stiffness, pes planus, flat feet, decrease in fitness, so maybe they were fit and active and then they go into a sedentary lifestyle, poor balance, fatigue, improper warm-up, poor calf flexibility, improper rehabilitation from prior calf injury. So maybe they were returned to play too soon and their body wasn't allowed to heal, and so they're predisposed to have another injury at the same area. And when we're talking about grade 3 strain, we're talking about at least 50 to 100% of the muscle fibers. If it is a complete tear, then surgery is recommended for active individuals. Elderly people can get away with maybe being immobilized for a month in walking boot and crutches, and then doing some stretching and strengthening later down the road. But if you're an active individual, to see the proper progress, they're going to want to most likely have surgery. And some of the signs and symptoms for this is immediate severe pain or disability. The muscle will be completely lost its function. So you're not going to be able to plantar flex when your knee is flexed, because the soleus is the main one that does that. It's isolated. The gastrocs can help with when your knee is straight, but when you flex the knee, you isolate the soleus, and so that function would be gone. It would be hard to do functional things such as walking up and down stairs, jumping, jogging, running. All those things you're not going to be able to do with a grade 3 soleus strain. It would be way too painful for the patient. This requires immediate immobilization. The patient's you're going to want to get that patient immobilized immediately for the best outcome for that patient. Sometimes soleus strains can go misdiagnosed, and so to determine whether or not if the muscle is completely torn, you probably want to recommend them to a physician and have them do MRI imaging to look at that muscle and see if it's completely torn, and then surgery would of course then be recommended for that patient. Symptoms tend to be on the lateral side when palpating. Obviously, it's going to be tender to palpation. You should see a lot of ecchymosis, swelling, edema, and bruising. Move into when surgery happens, it increases the phase of rehabilitation, and you can see a period between 6 months and longer, depending on the patient, how soon it's diagnosed, how well the surgery went, other factors like that. Here are my SMART goals for immobilization. I'll read one and then just give time to read the rest. But a patient reports a decrease in pain from severe pain, 7 out of 10 on the visual analog scale, to mild pain, 4 out of 10, through the use of mainly rice. And here are the rest. Good time to read those. So the PRE, progressive resistance exercise phase, this is going to be a lengthy phase. We're going to spend a lot of time in this phase. My SMART goals for this phase is the patient is able to walk with no assistance, so without the walking boot, no crutches, no heel wedges, with no pain, 0 out of 10 on the visual analog scale, through the use of cryotherapy, massage, active exercise, electrical stimulation, ultrasound, and laser, and some rehabilitation as well. Here are the rest of my goals. On the functional phase, patient between the 2 to 4 month period in the PRE, the patient should have extensive healing, and they should be now back to activity and living their normal ADLs and having their active life. These are some of the things I'm going to want to see in the functional phase. I don't expect the patient to be in this phase very long unless they somehow digress or respond differently than I'd like. My SMART goal for this phase: the patient can run up and down a flight of stairs with no pain on a visual analog scale through therapeutic interventions such as massage, cryotherapy, electrostimulation, ultrasound, laser, pretty much anything I'd want to use that I think would be beneficial to the patient and wouldn't hurt the patient. So the maintenance phase, we're trying to maintain flexibility, overall physical fitness. And so my SMART goal for this one: patient will run on treadmill for 20 minutes pain-free with modalities such as cryotherapy, massage, ultrasound, passive and active stretching, and laser. All these things, if necessary, if the patient still feels comfortable and then wants to use things. Mainly we focus on cryotherapy for fatigue, with the pain. If they want massage, anything really that I see beneficial to the patient that's been working, will continue. Here are the rest of my SMART goals during this phase. Alright, so in the mobilization phase, here are the modalities that I would use. Cryotherapy, ice bag preferably. We're going to use the Rice mechanism here. Rest, ice, compression, elevation to decrease pain and swelling. When you decrease the applying ice along with compression, we're decreasing the cellular metabolism, decreasing skin temperature. We're increasing fluid viscosity, slow that blood flow. So we're decreasing the need for oxygen as well, which will help with reducing the secondary injury. There's also reduced cellular output, slowing of the sodium potassium pump. These effects will help with decreased blood flow, which will decrease swelling and pain. Massage. When speaking of massage and mobilization, I know it can be contraindicated. However, I would only use massage for the purpose of swelling reduction, just having the patient lie prone, doing a nice milking massage, not digging too deep into the tissue, just to get some swelling reduction effects. Again, I would try this. If it didn't work, I would go to something else. I would take it out. Laser. Here, I would use laser with those parameters: decrease pain, promote tissue healing. We're trying to send in a different stimuli, decrease those nociceptors, those painful receptors, by sending in a different stimuli that will act on the gate control. Electrotherapy, mainly using TENS. Here's my parameters for that. We're trying to decrease pain here. Just putting the pads over the painful area, bipolar placement, and having the electrical stimulation block those nociceptors again through a sensory level only, not having a contraction here. Intensity would just be until the patient feels it, but it's comfortable, not a painful, and no contraction. The progressive resistance exercise phase, this is where really all modalities are at your disposal, other than the contraindications for this. Active stretching, active exercise, I would use this to increase intramuscular temperature throughout the body. Instead of placing a superficial moist heat pack, which really wouldn't get deep enough, it would not get deep enough into the muscle, the soleus itself, because it had to go through the cast, and the moist heat pack isn't strong enough to do that. So it's not really indicated for a soleus strain, so I would use active exercise, so I also get benefits of heating the entire body instead of just that one area. I would use therapeutic continuous ultrasound to promote tissue elongation, increase tissue temperature, increase range of motion, and aid in increasing the tissue temperature to aid we'd also get plastic deformation paired with mechanical stretching to really get that tissue elongation. Again, massage more vigorous, effleurage and petrissage to decrease swelling and aid in muscle relaxation, circulation and blood flow, fluid exchange, bring in those good things and push out the bad things. Again, I would use cryotherapy for the same reasons I described earlier in mobilization. Laser, I would use for the same reasons as mentioned before. Electrotherapy TENS, I would use it for pain control here because in the functional phase they can actually contract their muscle. I don't really need to use the electrotherapy as a means of muscle re-education. It's better for them to actively contract their own muscle. So we focus more on active exercise and rehabilitation here. I would just use electrotherapy, the TENS for the decrease in pain. There are my parameters for that. Okay, so the maintenance phase, again, we're just trying to maintain overall physical fitness and just tell them basically that we're not trying to injure them. And anything that I feel beneficial that the patient has responded well to throughout this whole entire process, I will use if I see fit. So to summarize this, we want to have conservative treatment of the muscle strain, especially the grade 3 post-surgically. Will take longer, about 6 months or longer, depending on the patient. We're mainly, when the injury happens, we're mainly going to focus on using RICE, rest, ice, and compression in the mobilization phase. Again, along with a little bit of the milky massage effect that can get through effleurage, but very light. My summary for this would be just to use modalities. If they don't benefit the patient, try something else. Obviously, don't use anything that will hurt the patient. Know the contraindications of each modality and know the patient, the patient's background history, so that contraindications don't come up and you don't hurt the patient. Also, just remember that every patient is different and every patient responds differently. So one modality might work on one patient, it might not work so well on another patient. So really just understanding that can be very helpful. Also, educating the patient on injury prevention, but just educating the patient on things such as how the modalities will feel, what they should feel like, what they shouldn't feel like, and being very resourceful and talking to the patient and helping them understand, so you build a relationship with the patient. And because if you can help them by saying something and you get good feedback from them, then it will only benefit the both of you throughout the process. And educating the patient on as far as injury prevention, so just things that they may have not have thought of, like stretching or a warm up before they exercise or cool down, things like that can help prevent this situation. And just keep in mind the contraindications, the correct parameters, treatment times. Again, telling the patient about the treatment time, the parameters, and because some of the stuff will be done at home, so the patient needs to know about these things and the contraindications as well. And here are my references.